My presentation is on the evidence-based practice and treatment for attention deficit hyperactivity disorder, or ADHD. ADHD is a neurodevelopmental disorder commonly found in children. However, there has been an upward trend of adults becoming diagnosed with ADHD, but we'll get to that later. ADHD presents with continuous patterns of inattention and/or impulsivity that impact function in daily life. 7.2% of children worldwide are affected by ADHD, and around 70% of those diagnosed as children have persistent symptoms into adulthood. The criteria to get diagnosed with ADHD include symptoms related to inattention, like keeping concentration or trouble following directions. There's impulsivity, which can present as interrupting when others are talking or doing risk taking behavior. And another hallmark of ADHD is hyperactivity. For example, an individual having trouble keeping still or someone who presents as hyperverbal. Children under 12 are diagnosed, and there has to be a significant impact on functioning in school, work, or interpersonal relationships. Clinicians specify the severity of the impact of symptoms as mild, moderate, or severe, as well as specify whether a client presents predominantly inattentive or predominantly hyperactive impulsive, or a combined type. There is a high comorbidity rate among children with ADHD. Some common comorbidities include autism spectrum disorder, learning disorders, tic disorders, major depression, anxiety disorders, along with conduct disorder and substance abuse. Different treatment approaches are utilized so that ultimately children can continue to function in their environment. Heavy biological influence on ADHD. Neurochemicals in the brain, dopamine, norepinephrine, catecholamine, and serotonin, support the prefrontal cortex and upper level functioning. One example of the responsibility of the prefrontal cortex is executive functioning. Executive functioning entails planning, self control, stress tolerance, and emotional regulation. When an individual has symptoms of ADHD, there are lower levels of the neurochemicals in the prefrontal cortex, and in turn, things like executive functioning, things like planning, emotional regulation become a challenge. Here are some treatment approaches to ADHD. ADHD stimulants are primarily used to treat the symptoms. The most common medications are methylphenidate, which is Ritalin, and amphetamine, like Adderall. Both have short acting and long acting formulas that increase the neurochemicals in the brain to make up for the lack of them, so cognitive functioning can be restored. The short acting stimulants can be taken up to 3 times per day, and the therapeutic effects start 30 to 40 minutes after administered. They only last about 3 to 4 hours long, though. The long-acting versions stay within the body between 8 to 12 hours. As with many medications, there are side effects to stimulants. There can be a loss of appetite, insomnia, and anxiety. There's also high prevalence of drug abuse for those who use these stimulants. For older adults, there can be cardiovascular symptoms such as high blood pressure and a racing heart. There has been limited research on long-term effects of continuous stimulant use to treat ADHD. Therefore, more research should be done in order to see the effects of long-standing use of a stimulant like Ritalin or Adderall. While medication for ADHD is typically the first line of defense, different modes of therapy and behavioral interventions have aided improvement in functioning for those with this disorder. Besides medication, there are many psychosocial interventions to treat ADHD. Specifically, cognitive behavioral therapy, or CBT, has been cited heavily as an effective modality to cope with ADHD. CBT focuses on building awareness, engaging in adaptive thinking, and reducing cognitive errors like automatic thinking to improve and maintain symptom management. Furthermore, CBT techniques also reduce comorbidity symptoms such as depression and anxiety. Along with CBT, there's dialectical behavioral therapy, mindfulness techniques, and neurofeedback. They've all shown promising results in decreasing symptomology. Now let's look at the goals of treatment for ADHD. The major goals of treatment for ADHD are to improve functioning and quality of life. Utilizing medication, psychosocial, and behavioral interventions, the end result is building awareness and reducing symptomology. Due to the biological component, medication becomes the first choice for many to start treatment. However, medication may not always work for some, the cons may outweigh the benefits. One study found that a combination of psychosocial interventions and a psychostimulant were the most effective, comparatively to only medication or only psychosocial interventions. The goal of the medication is to increase the neurochemicals in the brain so that there's a baseline to improve symptoms like executive function and emotional dysregulation and through psychosocial interventions. Problems with adherence to medication and following through with psychosocial interventions pose challenges in working on reducing symptoms. Next is outcomes for psychosocial interventions. The outcomes for CBT are to adjust thinking patterns to change behaviors related to inattention, hyperactivity, and impulsivity. Also, a cycle of underachievement due to challenges with ADHD enforces negative thinking patterns, which can inform symptoms of anxiety, depression, and negative self image. The role of the clinician is to support the client in practicing mindfulness of thoughts, assist in building interpersonal skills, and help build systems to increase motivation and build healthy habits to work on executive dysfunction. Another psychosocial intervention used for treatment for ADHD is dialectical behavioral therapy or DBT. The goal is to build awareness of symptoms and create behavioral change through self regulation. DBT interventions are based off of CBT. However, there is more of a focus on validation and acceptance perspectives. In addition to DBT, mindfulness is another effective intervention that reduces ADHD symptomology through the practice of meditation. Meditation can enhance awareness and self compassion. Those with ADHD can become frustrated in their day to day, so building that self compassion and non judgmental perspective can be important. Lastly, there's neurobiofeedback. This is a version of an EEG biofeedback that explores brain activity and operant conditioning. While neurobiofeedback shows promising results, there is limited data on the effectiveness, so technically it isn't evidence based. However, all of these treatments lead to the ultimate outcome would be to stabilize improvement of symptomology over time so that functioning at work, school, and in interpersonal relationships becomes easier for an individual diagnosed with ADHD. Next up is issues in diversity in ADHD. The stereotype in mass media for ADHD are young boys who are hyperactive and impulsive. The predominantly hyperactive impulsive type of ADHD is presented clearly in young boys, and so ADHD research has always included that population. However, this means that research of young girls with ADHD is extremely limited. The ratio for diagnosis of boys to girls is around 3 to 1 in childhood and eventually evens out in adulthood to 1 to 1. Research shows that the inattentive ADHD type may be more frequent in females than males. It can be difficult to obtain a diagnosis anyway, and getting an ADHD diagnosis takes time. If young girls do not present with the typical hyperactive or interruptive behaviors, then it becomes harder to diagnose them as they break the mold of what ADHD looks like. That's in quotes, by the way. Due to society's norms, women are taught to be less hyperactive in order to fit into the standard, so that forces women to suffer with these symptoms long term and in silence. Moreover, the discrimination towards females creates challenges as it can lead to higher rates of comorbidity and problems in handling adult responsibilities, for example, caring for a child. Women are now seeking diagnoses and treatment in adulthood due to the past underrepresentation and lack of knowledge about how ADHD manifests. Women aren't just in trouble with getting an ADHD diagnosis, people of color also receive low rates of getting a diagnosis compared to those who are white. Stigma is attached to ADHD as people write off the symptoms as delinquent or criminal behaviors, and that is highlighted even more in the discrimination towards people of color. One study found that people of color are more likely to be labeled as violent without others taking into account any mental health diagnosis. This means that people of color have less access to diagnosis and treatment, which prolongs challenges and suffering. Last but not least, there are environmental factors. ADHD is mostly a genetic disorder, like we discussed before, where a lack of neurochemicals affect brain functioning and cause changes in behavior and cognitive ability. Around 76% of children with ADHD have genes passed down through family that affect dopamine and norepinephrine levels. Along with ADHD being hereditary, Certain genes can become triggered from environmental factors that increase the possibility of ADHD, like temperament. For example, in a study, twins who were genetically predisposed to ADHD and who did not share school classrooms were less likely to show symptomology of ADHD. This suggests that different environments make an impact on how symptomology presents. Other environmental factors include supported home, healthy physical home environment, and opportunities to learn. Environmental conditions like socioeconomic status of both parents, substance use during pregnancy, as well as complications and trauma during birth are risk factors for ADHD. Protective factors related to supported home can decrease the susceptibility of hyperactivity and impulsivity. To conclude, ADHD is a neurodevelopmental disorder that stems from a biological component and environmental risk factors. Different short term and long term medications, as well as psychosocial interventions like CBT, can support individuals with ADHD to improve their quality of life. Moving forward, clinicians and researchers can acknowledge the lack of intersectionality and representation of individuals who have ADHD. It will be important to make changes to shift what ADHD typically looks like, as it's based off of research from mostly white young boys. So, thank you for listening to my presentation and have a great day.